Hello, everyone. This is Dr. Jaitly, cardiologist from New York, on your favorite source, MuniMeterHealth, mainly for educational purposes, only for patient enhancement of health literacy as well as continued medical education. So, our goal is primarily to provide you education. Obviously, for medical advice, seek your physicians. As I always say, and if it's an emergency or someone is having an emergency or you suspect one, so please go to the nearest hospital, consult your doctor right away, or call for an ambulance. And of course, in the United States, you can dial 911. So without any further ado, today I'm going to be talking to you about football injuries and blunt cardiac injuries as we talk about. And essentially, what you're looking at is blunt cardiac uh, trauma or injuries, as we call them, and they are basically affecting as a result of a projectile force of any moving object. It could be a football, or it could be the person who is actually also wearing a helmet, just like this individual here, and crashing into the chest. And we know the American football is, it's a rough and tough game, no question about that. It's an American dream. You wanna be at a Super Bowl one day. You wanna be not only as an athlete but even as a spectator. So it is a national pride, no question about that. But the fact is that it is prone for injuries, and that's one of the things that young moms and dads are worried about their younger ones who are now going to attend football. So they're going to the football academies, or they're attending football camps. Certain things you have to be very, very worried about, and that is one of the things that I always say, that look, if you have a precursor like a cardiovascular condition, I call it cardiac condition, if you will. I keep it very simple. Maybe say a congenital problem, or there is any history of syncope, which is like passing out, or there has been some history of arrhythmias or some abnormal EKGs, if you will. So these are some of the things that will preclude you from attending these camps and these academies, and the physician and the school nurse should immediately sort of have you screened by a cardiologist. And the various testings that are clearly involved are very, very few, but the fact is that they should be done like an ECG. Start with a basic ECG first. An echo is certainly warranted. Maybe a stress test, which will be a supervised, exercise, which I'm sure the athlete will, beat it. But the fact is that you have to have it supervisedly done. So this way, the heart rate achieved is more than 120% or so of the maximum predicted for that age. And then you try to do a 24-hour monitor, and a 24-hour Holter monitor, we call it. It's basically a small little gadget that's attached to your chest and with a couple of leads, and then you return it back the next day so the doctor analyzes it. So it's called 24-hour Holter monitor, if you will. I'm sure you've heard of it. Your dad and mom may have explained to you, etc., etc. Now, this is where the heart is looking from outside. So that's your exterior. This is my cartoon here, the schematic, and this is the interior of the heart. So you're looking at the outside of the heart and the inside of the heart, outside of the house, inside of the house. The house has 4 chambers, 2 upper and 2 lower. So it's like, and this being the master bed suite, we call it, the left ventricle, because this is the guy that's eventually ejecting out the blood into the aorta. So the aorta is curving around here like that. And if you will, I can draw it like that for you. So this is where the blood is now supplied to the body. So it's going via the aorta, we call it. So now the aorta is also prone for injuries because remember, it's sitting right next to the heart. It's a big hose. It's a big hose. So what are the possible injuries that can occur? Remember, the heart is made of a muscle. Obviously, it's a hollow muscle which is containing all these 4 chambers. So there's the interior of the heart you saw. The exterior of the heart is obviously has all this plumbing going. That's called the coronaries. And the coronaries are, they are the blood supply to the heart. Remember, blood is being supplied by the heart to the body. Blood has its own, the heart has its own supply, and that's the coronaries. And 2 sets of coronaries, the right and the left. The left very early on divides into 2, 1 and 2 here. This becomes the left anterior descending. This is your left circumflex, and this is your right coronary. Anyway, so don't confuse with the muscle. Don't confuse with the names. So muscle is one. The second is these are the valves right here. These are your valves. Okay, so the valves are very, very delicate parachute-like structures, and they could snap off, and that could result into an acute emergency. Then this is your septal wall, which is separating the two sides of the heart. So septum can get hurt during a blunt injury. We're talking about a moving football, or even while rest of the world is playing a lot of cricket out there, South Africa, India, England. So the cricket ball can hit. Even a baseball injury, a baseball can hit the heart. Okay, so imagine an athlete standing on the baseball field, and you have this individual standing right there, and he's about to receive this fast-moving ball of 110 miles an hour. And you can imagine if that hits the chest here, you could be in big, big trouble. The athlete can fall dead, unfortunately, or sometimes even have a severe contusion enough that the patient is markedly hypotensive and requires immediate visit to the emergency room, and obviously an EKG and an echo and all these testings we just talked about will be done. So just so that you understand that here the individual is playing, this fast-moving ball comes in, or sometimes an individual can hit the chest, another individual or several of the individuals can hit the chest here while he's running to cross those lines and score a goal or a touchdown. So we are looking at a great deal of impact from a moving object, which could result into a BCI, we call it, and that's the blunt cardiac injury or blunt chest injury. Because time and again people have talked about myocardial contusion or heart contusion, but just to simplify, I think the American Heart Thoracic Sports section really identifies this as BCI. Okay, it's also called commotio cordis, if you will, commotio cordis, which is secondary to a blunt trauma that the heart suffers an immediate death. Okay, so I know it's an interesting subject, but also it's a very delicate subject for especially young moms and dads who are sending their wards and their children over to these wonderful academies, which are now supervised, obviously. But the fact is that injuries do occur, and that's the whole idea of bringing you for this awareness. So the muscle injury, a valve injury, a septal wall injury, or even a free wall injury, we can include that. So atrial injuries and ventricular injuries, and we can go on and on. But the fact is that these are, and sometimes an aortic dissection can occur, like an aorta can get torn off. So all these things can happen. Okay, looking forward to talking to you again on MuniMeterHealth, your favorite website. So please stay tuned and for more exciting stuff that's happening. Okay, so long. This is Dr. Jaitly.